Jamie Tierney. I'm working towards a PhD in biomedical engineering, and I'm working for Dr. Brett Byram in his Biomedical Elasticity and Acoustic Measurement Lab, which is the BEAM lab for short. So the BEAM lab is working to improve ultrasound imaging for clinical applications, and so improving beam mode imaging, blood flow imaging, and then we also do stiffness estimation techniques, so improving quantitative measurements with ultrasound. Okay, so I work on improving slow blood flow imaging or perfusion without the use of contrast agent. Perfusion is important because it involves the exchange of nutrients from the blood to tissue, and conventional blood flow imaging is not so great at perfusion imaging for really two main reasons. One being that blood signal is much weaker than tissue signal. And the other problem is that tissue moves, and so that makes separating the tissue and blood signal really difficult. And so we're working on a signal processing technique to better separate the tissue and blood. So I started this project from scratch when I started grad school, and so I spent a lot of time developing the technique, and my next step will be to start to translate this method to be used for clinical applications. So the desired outcome would to be able to use this as a tool for monitoring and evaluating taste treatment for patients with liver tumors. To wrap up my experience, it's been really cool to be able to work on something from scratch and within my PhD hopefully see it actually used on patients, which I think is unique to a VISE lab.